So here we go. Here it is. If the issue is hormone imbalance, which I'm led to believe it is, considering it's not marijuana or steroids, is there not then the possibility of developing gyno once again? So yes, there is. And the thing about gynecomastia is, yeah, it absolutely depends on the cause, and steroids and what have you, like especially like steroids for bodybuilders can do it. And basically it is a hormone imbalance, and there are certain things that can cause a hormone imbalance, like certain drugs like the ones we mentioned, but also ones that are treated certain cancers. Also there are certain tumors that can cause it, so testicular tumors, pituitary tumors, tumors with the adrenal gland, liver tumors. There's certain tumors which can produce hormones and cause an imbalance between the estrogen and the testosterone, which can cause gynecomastia. Also, certain times of life, there are hormone imbalance, particularly during puberty and in senility, as in older age. You get an imbalance between the estrogen and testosterone, and you can have too much breast tissue growth. So these are all the causes of gynecomastia. And if you have an underlying cause of gynecomastia, you need to treat the underlying cause of the gynecomastia. And so if it's happening during puberty, then you would say, well, let's wait till puberty's over with and see if it gets better. If it's due to some medication you're on or some drugs you're taking, if you can stop that medication or those drugs, then it will be that's the right thing to do first. If it's due to a tumor, then you need to get that sorted first to stop the hormone imbalance, because you're absolutely right, it will come back in. The problem is that the majority of cases are what we call idiopathic. So whilst there's a huge list of cases of causes of gynecomastia, the majority of cases are idiopathic, which means we don't know the cause, which means there is no underlying cause. And so the majority of cases, there's no underlying cause. So if you're worried you've got an underlying cause, if you have symptoms, if you have symptoms of any of these cancers, testicular cancer, pituitary cancer, they all have symptoms associated with them, then that needs to be investigated to see if there's an underlying cancer. Similarly, if breast cancer can cause increased growth of one side, but it's usually one side, it's usually hard, it can often be painful. So if there's any worrying features, you get that looked at and treated. But the majority of cases are idiopathic, have got no cause. And if it's idiopathic, then you can treat it because there's no underlying cause to treat. So that's why if bodybuilders are still taking steroids, I say there's no point in having gynecomastia treatment because it'll come back again. So if it's idiopathic, then you treat it with by removing the glandular tissue and the fatty tissue. The only thing I would say is that sometimes people say it's come back if they put on weight. You take all the gland away and all the fatty tissue away, while you leave a little bit behind the nipple, because otherwise you get a crater deformity, you get a dent. But anyway, take it all away, but you do leave some fat behind. There will still be some fat there. So if your weight changes, particularly if you put on weight, that fat will get bigger. The whole thing about putting on weight, you've got the same amount of fat. Everyone's got the same amount of fat cells. Fat people have just got bigger fat cells than thin people. So the fat cells get bigger when you get fat and smaller when you get slim. So you will still leave some fat cells there. And so those fat cells can get bigger. So if you put on weight, then it can come back again, sort of thing. And people say it's coming back again. It's not coming back again. It's just you put on weight and you're getting fatter. So if you hadn't had the gynecomastia correction, you would have got bigger as well. So it's not a recurrence of the gynecomastia. It's not like, oh, there's an underlying cause, it's all coming back. It's you put on weight and the fat's got bigger. So that's the only other thing. So headline question, can it come back after having surgery? If there's an underlying cause, yes. The majority of cases don't have an underlying cause. And if you put on weight afterwards, then it can get bigger. It's not it coming back, it's just you're putting on weight, but you've been reset to a better position. I think we've got that one there.